of AmCham EU. For those of you who don't know, the AmCham EU, we represent over 155 companies of US parentage committed to and invested in Europe. And I'm based here in Brussels today. And we have two overarching priorities. One is the single market, building a united EU, and the second one is to maintain and strengthen the US dialogue. But that's not what we're here to talk about today. This morning's event is organized by one of our task forces. It's our Diversity and Inclusion Task Force. It's a group we're very proud of here at AmCham EU. And over the years, this task force has brought together member companies to raise awareness and share best practices about diversity and inclusion in the workplace. And in parallel to that, we engage with policymakers and have done and continue to do so, we believe successfully, to showcase our commitment to a more inclusive and diverse workplace across Europe and beyond. And really the point here is that this includes understanding of mental health and accepting this. I think we accept and recognize physical disability, but not yet sufficiently mental illness. I mean, I speak quite personally here as well. It's not visible in so many cases. In fact, 67% of women, according to McKinsey, said mental health was their biggest coronavirus-related challenge. So that's why the topic of this morning is about mental health. It's an issue that we at AmCham EU really deeply care about. As I said, I care about it personally, and I'm sure everyone in the audience here has dealt with at some point, either directly or indirectly. So indeed, I'm sure if we all look deeply, perhaps somebody here knows somebody with anxiety, and I'm not even talking about depression here. I'm simply talking about anxiety, if we're really honest with ourselves. And I was personally touched deeply recently when I listened to the story of the wife of a UK MP, a high-achieving female in her early 60s, no signs of anything, no medication, not miserable, no alcohol, possibly a little bit anxious, no signs, and she sadly ended her life. Now, I listened to her husband talk about this. It's really very moving. Did you know that 6,500 people a year end their lives? I didn't. That's 15 jumbo jets a year. That's one person will end their life in the next 90 minutes during this call. One person every 90 minutes. And what I didn't know either was, did you know that 135 people are impacted directly by just one suicide? And I think these are truly horrific figures. Over in the year 2020, AmCham EU as an organization lost two of our dearest and very long-standing members here, individuals, to suicide. Now, it's not my place, I don't know the full reason, but never before in my time here at AmCham EU, and I've been here over 25 years, have we ever lost members in this way. Now, Owen Patterson, the MP who I referred to, he calls for people to stop being embarrassed about talking about anxiety. We're not even talking about depression here. We're just talking about anxiety. I mean, how many times have we avoided a conversation when someone said, we've asked somebody how they are and they say, oh, I'm feeling a bit down. What do we do then? Have we avoided the conversation? Are we embarrassed? Is that person embarrassed even to admit they're not feeling great and happy that day? They've always got to feel energetic. Now, I don't have the solutions. We've got the experts here today, we hope. But certainly, I do believe that we need to break the taboo about talking about this, and to make judgments about people who might even admit that they have some sort of anxiety or mental health problem. Now, the COVID-19 pandemic has clearly had a very strong impact on people with mental illness. It's taken away that safety network of social relations that's so important to keep all of us afloat, myself included. It's left many people in difficult family situations or solitude. I'm here pretty much alone in the office. There's no one to talk to at the coffee machine. I have one colleague here today, I have to admit. No coffee moments to have a talk. And then what about young people? In many cases, young people's mental health has also deteriorated considerably. Homeschooling's the norm. I mean, I have 3 kids. They've all have one graduation online, no physical graduation, studying constantly online with no interaction with anyone. This is not normal. 1/4 of suicides are of young women, and many of them are young. Sorry, 1/4 of suicides are women, and many of them are young women. And we haven't even mentioned social media at this point, which is another angle to think about. So, I don't want to depress us all at the beginning. I'm generally a not very optimistic person, but I would like to say, how many of you have children or friends of friends who are suffering? And I think we could probably all name at least one person in our circle if we're really honest. So maybe we should all stop saying, get a grip, be strong, grin and bear it, or just stop worrying. And maybe we should just stop to talk to that person. So in this difficult scenario, we at AmCham EU did ask ourselves what we could do to try to contribute to raising awareness about this second crisis. The COVID crisis is the first. This is a second epidemic. And so we decided to start off with what we can do best, which is bringing together institutions, corporate representatives today, and start a conversation to share best practices about what companies and everyone is doing to address this issue. I do believe we need a dramatic step up. So rest assured, we're at the beginning of this journey. We intend to use our platform to inform, to mobilize and inspire people to act into support of those dealing with mental illness. And so for today's event, we have some great speakers to share, who we've invited to share their experience and expertise of. And with that, we will listen to keynote remarks from our Member of Parliament who's present here today, Maria Walsh. I would like to introduce you, Maria. It's an absolute pleasure to have you today. Maria is a member of the Parliament for the EPP group. She sits in the Employment and Social Affairs Committee, as well as the Committee for Culture and Education. She is also the co-chair on both the Mental Health Alliance and the Coalition of Mental Health and Wellbeing Intergroups in the European Parliament. And with that, Maria, the floor is yours. Thank you so much.
Oh, good morning, and thank you very much, Susan. And I'm here scribbling notes as you're speaking. Many of the statistics that you shared, I hadn't heard. And to desensitize and not highlight or be stark about it is I think one of our big problems. And actually sitting in the fact that each and every one of us has mental health and well-being. We have it. How we talk about it, how we protect it, and ultimately how businesses engage with us. And I made a remark before we officially kicked off about you can have KPIs and culture, and you can have mental health, and all within the same space in delivering. But before I go way off script and really cut into my time, let me get back on track. I'm delighted to and really honoured to engage with you all. And I feel really proud that you've asked me to speak with you today. I'm extremely grateful that employers and organisations like yourselves are engaging in a discussion about mental health and how to instill good work practices to ensure you're adequately and really driving promoting of good mental health practices. Now, in case everybody's wondering, I have a few notes in front of me, a little script, because as an Irish woman, an American Irish woman, born in the States but raised here in Ireland, I if anybody has been to the Blarney Stone, I didn't kiss it, I ate it. So I tend to chit chat along, and I don't want to cut into time. So forgive me if I'm talking about mental health, but my eyes are not engaged. I'm just following my notes. Let me just do a brief introduction, and Susan very kindly and warmly opened up there. But for those of you who don't know me, my name is Maria Walsh. I'm a member of the European Parliament representing Ireland's Midlands Northwest constituency, a predominantly rural area we're about home to about 1.5 million people. It touches Northern Ireland and is the most westernly point in our European Union. Here I am virtually connecting you from a very rural region just on the border between Mayo and Galway. My national party in Ireland is Fine Gael, and I sit within the EPP, which is the European People's Party, in the Parliament. In my role as an MEP, I'm co-chair of both the MEP Alliance for Mental Health and the Coalition for Mental Health and Wellbeing, the two mental health focused interest groups within the Parliament. The question of mental health is so vast that both interest groups tackle very different parts of this ongoing and growing issue. Long before COVID came into our lives, mental health was impacting citizens. Long after, it will continue to impact. So we have, dare I say, an amazing opportunity now to fix and look at and really open up the dialogue of mental health and well-being. A very guiding principle for MEPs invested in these two interest groups is the fully recognising that people's mental health and well-being depends heavily on a variety of social and socioeconomic factors, and therefore requires cross-sectional approach through a variety of EU policy initiatives, engagements, and organisations like yourselves. There has been a rising level of attention paid to mental health in recent years. European governments are slowly chipping away and responding to citizens' needs for effective mental health care within the healthcare systems. And at a European level, more politicians and leaders are pushing Europeans' mental health at the very heart of policy areas that would have previously never considered mental health within their remit. And I'll give you one good example in the Parliament. It's the Right to Disconnect Directive, an excellent example of a modern solution to a very modern pressure point. The policy spans itself across employment, technology, economy, civil liberties, and health. And this, I believe, similar ways to this is how I think we should be tackling mental health policy. Always constantly thinking about the cross-sectional input, engaging with private and public cooperation, taking in innovative ideas that benefit more than just the social and healthcare sectors. Mental health is everyone's business. We need the holistic approach, and cross-sectional input is, in my view, key to making in long-lasting change. We have a very unique opportunity now to adjust and readjust our policies for what the new normal is and will be. Some things will not return to the way they were, like the nature of work, I believe. As a member of the Employment Committee within the Parliament, I think it is really essential that MEPs like us look at our future work on employment policy through this lens. Even more than treatment or preventative healthcare, we need really impactful policies that tackle the root causes of mental ill health. That's poverty, deprivation, discrimination, unemployment, lack of educational opportunities, fairness, and these are just some of the biggest detriments I believe impacts mental health and well-being. And I'm really looking forward to the other speakers share their input from their lengthy experience within this sector. The COVID-19 pandemic has shown us a glaring need to reflect on how we develop policy making within the mental health space. This is why I, with the support of my colleagues, have started a call for a European Year of Good Mental Health to raise the awareness of all aspects of mental health policy and really encourage debate in our institutions and in our member states and change the prevailing attitudes towards mental health across the EU. I believe this would send a very strong commitment and a political signal from the EU institutions and member governments that mental health will be taken into consideration in future policy, and that we must make mental health everybody's business. And I acknowledge, Susan, as you were sharing there, we accept the physical disabilities or the sick day, but when we talk about mental health, we get uncomfortable. And I don't mean to generalize, but I'm going to generalize this here for case of argument. We get uncomfortable. We don't know where to go or how to lean into the fact that everybody has mental health. So therefore, it should be in all policies, our culture and our brand values, not just in the institutions, but in our schools, in our businesses, within our homes. Mental ill health presents a major challenge to the well-being of our society and the strength of our economy. It hinders and can destroy lives, as Susan outlined in her words. It traps people in poverty and prevents our countries from harnessing the talents and the potential of hundreds of thousands of people that make businesses like you all really engage and drive forth. While we are making slow progress in policy making that can affect real change on the ground, we have to think laterally across sectors and policy ideas to find the holistic solutions for Europeans' whole lives. And I know, Susan, we're gonna ask some questions, but just to finally finish up my few words. In October 2019, at a Mental Health Alliance, it was our first mental health meeting within the Parliament. I'd said a few words, and I often repeat, so I wanted to share with you and your community this morning. Without mental health, we cannot have a solid health base. Mental health doesn't see borders, much like our pandemic that we're currently living in now. It doesn't see borders or a person's skin color or orientation or mother tongue or gender. It doesn't see where one community starts and one ends. It doesn't even see if a business is doing well or not. It's our citizens that are at risk if we don't get this right. Mental health is everyone's business. And I'm really delighted and really honoured that this conversation is kicking off. It cannot end here, though. It's truly important that every one of us connects with someone or another, a few people on this call, talk about what best practices they're bringing into your businesses. And this conversation might happen today, May 11th. So what's going to happen May 12th in your business? How are you going to talk or impact your employees? And Susan, apologies for cutting into my time, but thank you very much for having me.
No, that's okay. Thank you, Maria, thank you indeed, Maria, for your remarks. And thanks for kicking this off. Maybe, indeed, I know it's inspiring to hear you speak. Just a couple of short questions, and then we're going to hand over to Elizabeth and get so just some quick answers here. But maybe picking up on your point, you had the idea there of, I think, year of mental health well-being, but perhaps just to expand on that, it sounds like there is a lot going on, but how do we really mainstream it? How do we make sure that at institutional level, the decision makers do take this into consideration? Indeed, you said it needs to be embedded in all policies, or that they need to consider the mental implications of any EU policy. How can we really ensure that is mainstreamed?
And phenomenal question. One that I wish I had a really easy answer of saying it's happening tomorrow morning. Everybody's on board, and Ursula von der Leyen herself is signing off, as well as Charles Michel. But I think the way we engage and we talk about mental health and well-being is not at the forefront of everybody's brain that we need it to. But then again, this is what's so important about conversations like this, that you begin to bring more and more people into the space. Outside of the European Year of Good Mental Health, we're also developing as co-chairs within the both interest groups around mental health in the Parliament, a comprehensive and proactive EU mental health strategy, taking into all the key points that hopefully many those on the call today and yourselves would buy into, would engage with, and bring out, and ultimately seeing the fact that we spend 4% of GDP in the reactive space of mental health. So how do we actually roll back on that and look at preventative measures, and again taking into the cross-sectional avenues that different policies have on mental health and well-being. And I mean, my team and I, they make sure my feet are on the ground every time we talk about mental health, which is on a daily basis, because excuse me, for me, my utopia is that the European Union looks at mental health as a competency and not puts it back on member state. So therefore, when we have conversations like this, I'm able to turn around to you and say, the Commission and the Council have signed off on an EU mental health strategy. We've signed off on a European year, and it's going to happen and we're going to have a mental health awareness month and actually give best practices to business like your organizations. But we're not quite there yet, but we will get there eventually.
Thanks for that, Maria. And maybe then just finally to pick up on the last point about business then. We have a business representative on the panel coming up, but what advice would you give? We've got business on the call today. What advice can they pass on either to themselves or to the company leaders if they want to improve company practices on mental health? Have you got maybe 3 tips or one strong tip to give us? Well, I tell you what, one thing that I've gifted myself and my team and my citizens and the constituents that I represent is I utilized my COVID time of non-traveling, and I went back to school and I did a QQI in life coaching, and it was a way for me to upskill on active listening, on
how to ask powerful questions, and actually, much to how you say, so when I am around the water cooler or the coffee bar, or I'm passing a staff member, a constituent on the street, that I actually stop and say, you know, how are you doing? And I feel comfortable waiting, you know, in support of that moment if the person says, you know, today's not a great day, so that I'm bringing my best self forth in order to support that person. And that was just an easy, difficult though, hard. I had to do a lot of introspective work on myself in order to best support others. That's one key fundamental way that I found. Others is, you know, I think we have, I think we're great at creating, and this is, as a young politician, this is one thing I'm always trying to figure out, and I've never found the solve for it. We're great at creating policies, and we're great at making best practices and having the pieces of paper. But what happens to the piece of paper, and why is it sitting on the shelf collecting dust? And ultimately, I believe, you know, if you're creating a diversity inclusion project, if you're talking about mental health best practices in your business, why not feed into those that are in your business every day so they buy into the culture and start the difficult conversation? And ultimately, I'd love to hear from other speakers, it's not, you know, the power of ourselves are within ourselves. And I think a lot of uncomfort lies in people feeling that they have to have all the answers for when they get asked the questions. But ultimately, the questions come from a powerful conversation. And I think if we take away from the fact that we have to have all the answers now, and that's a very vulnerable moment for me as a politician, because people look at us to say you have to have all the answers, but I don't. And no politician does. And if we say we do, then that means our ego has taken over and we're actually not listening to what's going on the ground more. But there's a lot of ways, but it comes down to gifting you and your staff and your community's time to sit back and throw out a question like, what does mental health mean to you now in the midst of a pandemic, coming out of the pandemic? And what can we do together to make sure if a pandemic happens or a hard day happens, that we have that cross-sectional support, or we have the skills, the resilience for the transition periods, because transition periods happen every day. You know, we have difficult days all the time. And it's really important that we highlight the resilience, but we also talk about the learns for when things don't go well, and that everybody feels safe, that they can come to the conversation, putting their hand up and saying, I'm having a bad day and I can't see the end of the tunnel. So someone needs to just walk with me for a little bit. And that should happen on an everyday basis. Thank you.
Yeah. Thank you so much, Maria, and thanks for taking the time to speak and answer those questions. And we continue the work together. Just so you know, we're going to be here. We're not going away anywhere, certainly not at the moment. So you know, look to us as a resource and a platform. So thank you very much, and do stay around. So now I'd like to hand over to our moderator for this morning's panel. That's Elizabeth Krakoletz, who's associate partner at EY, Elizabeth, and chair of our AmCham EU Diversity and Inclusion Task Force here at AmCham EU. And she's absolutely the driving force behind so many of this task force work and achievements to date. Also true for this event. It's you who's driven this, Elizabeth. So thank you so much for your dedication and all the great work so far, and really looking forward to the discussion now. Thank you, Elizabeth.
Thank you so much, Susan. And I would like to also welcome everyone joining this very important debate. And being a driving force behind these discussions is not sufficient. You always need a good leadership. And with AmCham EU, I'm really pleased to say that all the ideas, all the initiatives we raised and that we find important, Susan and her colleagues fully support it. And just before I start introducing the panel, I myself, I would like to share a little personal experience, because I work and support lots of victims. I myself, I'm a victim as well. 5 years ago, there was a deadly terrorist attack in Brussels. I was seriously injured, and I went through, unfortunately, mental health issues. Luckily, I managed to get over, but it was only thanks to family and friends. 5 years ago, you can imagine that we couldn't talk openly a lot about, and I was always afraid of bearing the stigma. So it's not only that you can't talk about, but also you need to consider the stigma part. And what I always try to explain others that how you can best support victims and those with mental health issues. If you stop for a minute and try to imagine that you are in the shoes or in the place of someone with mental health issues, and how would it look like? What do you want others to look at you? What questions you would like to get? And of course. What support you are looking for, and basically it's not so difficult. But people who are not in these situations, they feel that it would never happen with them. But I can assure you that it can indeed happen with everyone. And the worst thing, if someone, a victim, those who suffer from mental issues, feel isolated. Because at the end of the day, if you don't feel that you have a supporting environment, it can be work, it can be your family or friends. I even lost friends because it was too much for them when I talked about it, and I was of course very sad. But I gained lots of new friends. Those who we can discuss, and of course raising awareness is absolutely critical, because that's where the change starts. And the beauty and the opportunity for our job as public policy experts, corporate experts, trade associations, is that we can indeed generate this discussion, get people cross-sectoral around the table, and we all know, because that's part of our job, that impactful changes always start with good policies. And I'm also very happy to see that over the past 10 years, there is more and more understanding that to start good policy discussions, we need to bring various sectors together. And this panel discussion is a great example when we have representatives from policymakers. We already heard Maria from the European Parliament and the EU institutions side. We are going to have OECD speaker, corporate speakers, and we also have a practitioner who works for the community health service, Simon, and that's a service that provides English speaking support for those who are based in Belgium, in Brussels, but they don't speak at the required level the local languages, Flemish, French, or German. So they also provide tremendous support, and I'm personally also very pleased that my former boss, after his retirement, is now the president of CHS. So it's a great example, and also he can himself bring different angles and the business community closer to this discussion. Without further ado, I would like to very quickly introduce the panel. You can find more details about their professional background, but it's really important to note that not only that they are excellent, outstanding experts, but they are also very passionate. We had a prep call yesterday, and that was the point when I really felt that today's discussion is going to be a real life discussion with people who are passionate about the topic and able to make a progress and improvement in terms of getting better policy proposals at the appropriate level. The first speaker, and I'm just going to give the names at alphabetical order. Simon Weyer, who I already mentioned, organizational psychologist and counselor at CHS. Laura Lucini, Associate Vice President, EMEA Regional Head, Global Clinical Trial Operation, MSD. Shunta Takino, Junior Counselor, Labor and Employment Division at OECD. Alvin Tremoulet, Global Diversity, Equity and Inclusion Leader at Pfizer. So you see that the speakers bring both practitioners, policymakers, and corporates around the table. And I think probably the best way to start the discussion is to hand over to the OECD representative, Shunta, and not only by setting the scene, but also if you could share with us some recent data, what you have experienced, and of course we have been discussing developments, and during the preparatory call you also mentioned that there was an initiative 5 years ago, and I believe you can now have data compared to 5 years ago. So can I please ask you first to set the scene and share with the audience what have policymakers been doing to respond to this large-scale emergency mental health situation, also supporting with some data?
Thank you very much, Elizabeth, and thank you to everyone for the opportunity today. So I'd just like to begin really by kind of mapping out the scale of the challenge we face, and then I'd like to go into what kind of policy responses that we've seen across countries. So just in terms of the scale of the challenge, the prevalence of symptoms of anxiety and depression, and these are really the two most common forms of mental health conditions, really rose sharply at the onset of the pandemic. And really, while prevalence dipped during the summer of 2020 in many European countries, it's really increased again. So I know many of you are in Belgium. So in Belgium, for example, in the latest survey from March 2021, so around 21% of the general population were reporting symptoms of anxiety, which is almost double that of the level recorded in 2018, which was 11%. And again, 21% are also reporting symptoms of depression, which is more than twice as high as the 9.5% who are reporting symptoms in 2018. And as Maria mentioned, in her keynote remarks, it's really important to note that, of course, everyone has mental health. And so many more people are also experiencing symptoms of mental distress throughout the COVID-19 crisis. And just to add, a really important point here is that, of course, we all have mental health, but not everyone is being affected equally by the COVID-19 crisis. And that's, of course, in terms of employment outcomes, but also in terms of mental health. And broadly speaking, financially insecure individuals, unemployed individuals, young people and women, these are kind of groups that we're seeing a greater deterioration in mental health compared to other age groups. So just maybe a little bit more data nuggets. So in France, Belgium, and the US, for example, we're seeing about 30 to 80% higher, 30 to 80% greater prevalence amongst young people of symptoms of anxiety and depression compared to the general population as of March 2021. And in Belgium, again, just so we get an image, among 18 to 29-year-old women, the prevalence of symptoms of depression or anxiety is about double the rate among the general population, at about 40% for both. So that's the kind of situation we're coming in from, and it's a very serious situation, and many people are experiencing mental health issues. The good news in some sense is that governments are taking and have taken some immediate steps to try and scale up mental health support, and in some cases even increase funding. And this really spans all areas of policy, and it's really important that we have a cross-sectoral effort, as Maria mentioned. But thinking about what governments have done, increasing capacity of emergency mental health hotlines, trying to shift from delivery of mental health services remotely to from in-person to online, and then thinking specifically and really trying to get this discussion about integrated thinking going. There's been this measure called job retention schemes that have been put into place in many countries to support employers in retaining their employees. And these really have had an important effect in actually cushioning the mental health impacts of the crisis. So in the UK, for example, workers put on job retention schemes were less likely to report poor mental health than workers who are made unemployed. And of course, long-term unemployment is a major risk factor for mental health throughout the life course. So policies like these to support jobs and livelihoods during the crisis have also played an important role in promoting mental health. And just, Elizabeth, as you mentioned, the work that we do at the OECD, in 2015, member states of the OECD adopted a recommendation called the OECD Recommendation on Integrated Mental Health Skills and Work Policies. And really, this is getting to the crux of the issue that we need an integrated approach to addressing and improving support for people with mental health issues. And yeah, I look forward to going into more detail as we go.
Thank you so much, Unta, for sharing this valuable input to this discussion. And We've been talking about mental health, of course, throughout today, but I thought that it would be quite important to ask Simon, who is a practitioner, what is exactly mental health? We all have mental health, but as a practitioner, how would you define mental health?
Thanks, Elizabeth. Thanks for the opportunity to speak too. I'm really impressed actually with the conversation so far, and everyone is aware of this mental health phenomenon. We all have it, and I guess we like to talk about it as being on a spectrum. You know, everybody has mental health, and you either have you're either strong at the moment or weak at the moment, but it's always in flux, and it could depend on as much as if you had a good sleep or not, let alone being in 15 months of lockdown. So mental health, personally, I like to think of it as health, really, trying not to separate the conversation between physical health and mental health. Just it's health. And today I feel a bit sad. Yesterday I had a headache. That these conversations shouldn't really be separate domains. And I think that's the healthiest perspective that we can have. One thing I wanted to pick up on is these statistics that Shunta just mentioned, and also Susan mentioned in the beginning, suicide. And from CHS, we're seeing a massive increase in callers experiencing distress. There was over 350% increase just in that category since from the first quarter 2021 versus first quarter 2020. And to a large extent, these are young adults, adolescents, female also. And I just want to also throw out there that we need to really look at education and schools as part of the conversation around organisations. The impact of or the impact upon students' health and well-being at the moment is really extreme. We're seeing increases in bullying, depression, distress. So you know, mental health at the moment is really it's quite sensitive. People are stretched, people are strained. There's really this muscle that we have to be resilient is being stretched to the limit. And the way I think that what we need to really look at is this interaction. The context is really important with mental health. And I think this conversation that we're having today really emphasizes that. And I really appreciate that the policy that frames the context for mental health is so important. But it's then this interaction, which we've also acknowledged, where bringing that into practice and actually getting people to act, organizations, leaders, teams, and individuals through all those levels to promote and acknowledge that mental health is a business conversation. It is a professional conversation, and bringing these conversations into into the one kind of domain, instead of, you know, at work asking somebody, you know, how are you going? Where that's not just something, it's not just a greeting. You say, yeah, fine, and then move on. Where it becomes a professional conversation because it affects your professional life. I hope that answers your question. So I'm very passionate about this.
Thank you so much, Simon. Indeed, it was great to hear from you. And so far, we haven't heard from the corporate community. And indeed, there are quite a lot of good practices, as we learned during the preparatory call, which I was really pleased to hear. And if I can ask Laura first, if you can share, as Simon also pointed out, how to bring these into practice, and what are the practices that you find impactful, because to have policy is probably not sufficient. We also found a study saying that 5 employees out of 6 feel that their employers don't do anything or enough in terms of supporting mental health issues, which is quite alarming, because I'm aware that corporates indeed do a lot. So Laura, if you can share some good practices.
Thank you, Elizabeth. Thank you so much. And thank you for all the previous speakers. Amazing to yes, can you hear me? Yes, good. So thank you, Elizabeth, and thank you for the speakers and for all the good data and information and sharing of practices that you have done so far. And I'm really honored to be today with you and with this audience. And if we think about all those guys, and so I think Shunta was talking about 21% of the population in Belgium with anxiety, and then we were speaking about all the policies that we need to organize, and then we need to go into the companies, right, where those folks are working and where those policies are being implemented. And the responsibility starts, certainly, it's with each of us, and mainly in an organization with the leaders. And so today, what we can see at MSD is that mental health is at the speech of every leader every day, and this helps a lot, because people feel comfortable that it's okay to talk about that. It's really well linked with the diversity and inclusion as well, because as we talk about including different ways of living and different ways of loving, we also want to include different ways of feeling. And so one day you're not okay, and it's okay not to be okay, and to talk about that, and to try to find a different arrangements that could help you go through this moment and reorganize ourselves. So really, the leadership is the basis and the starting point. And then we have many corporate activities and procedures and initiatives. So training is very important as well. So other than talking about mental health, we want to equip people to be able to better have those conversations, because as we were commenting before, we feel uncomfortable sometimes. We don't know exactly what to do. Elizabeth, I think you were sharing that you made new friends, and you even have lost some friends, because sometimes people doesn't know how to deal with that. So training is a very important one. And so in the company, we have offered training on mental health for all the line managers, in terms of helping all of us to deal and have those conversations with our teams as well. And another very important point that we have introduced this year is that everyone in the company will have a diversity and inclusion topic as a priority. So each of us have been invited to think, what are you going to do in terms of diversity and inclusion as a priority this year? And this is so much linked with the mental health as well, so that we can ensure that people feel that they can be included, not only accepted, but really included and contribute and bring their best self and their best value to the company, being just as they are. And also they know that we all know that we can get the support that we may need at a certain moment.
Thank you so much, Laura. And it's indeed very important that we bring our best selves. And I'm really pleased that Alvin is with us from Pfizer. At Pfizer, she's the global leader of diversity, inclusion, and equity. And of course, we would be very, very pleased to hear from you, Alvin, some global perspective, and also from the perspective of diversity, inclusion, what it means, what mental health means, and what solutions there are.
Thank you very much for having me, and especially among those other experts in the room. So thank you very much. First of all, I just need to correct. So I'm Global Diversity, Equity and Inclusion Lead, among others, not the group lead, but I am among other leads in the team. I was really interested by what Simon said about it's a business conversation. And he talked about leaders, managers, and individuals. So something I want to touch upon is about the cultural aspect. Of course, every company has a culture, and all companies are not at the same level of maturity, and it's the same with countries. So at Pfizer, we have 4 cultural traits. We have excellence, courage, joy, and equity. And clearly, having equity at the heart is really making a difference. Like, we are really making sure that every person deserves to be seen, heard, and cared for. So and really having equity and having leaders setting the tone, having the CEO himself really making sure that he's sending emails, constant emails about, ensuring that our employees are really taking time to rest. For me, it really empowers the entire organization to really, sometimes be vulnerable. And I've seen this during the pandemic as well, like things that I didn't see before. Like we have currently, one example is, instead of having 1 hour meeting, the high recommendation is having 30 minutes meeting. Only 30 minutes. This is across the company, that's how we're functioning now. That's one thing. Another thing that I observed during the pandemic is really starting, and I think Maria shared that when she started about checking in as a leader, as a manager, before every single meeting, really checking in with every person. How are you doing? And that's something I observe, I've seen managers and leaders doing, which was not the case before. And when we talk about going back to the culture, I think having equity as part of our value is really making sure that there are many talents and that there's diversity of talents in an organization. And sometimes we need to adapt to those talents. Equity for me does not mean equity for another person. And I think it's Shunta who talk about the women who are really suffering hard. And when we talk about women, there are different, realities among women as well. We need to take into account. And again, back into equity, something I've seen is, yes, you're all working from home, but how do we ensure that there's no meeting, for example, at 1 p.m. at 12 when it's really family time? How do we ensure that we don't have a meeting at 5 p.m. when it's time to go and pick children at school? And really just okay as well at sometimes, like, you know what, today I don't feel okay. And for managers and leaders just to understand and acknowledge that. And that's something that was also new. We also, I think it's Simon, that psychological safety piece is also, and I think Maria also talked about that. Sometimes I myself, I experience a tragic loss in my family due to suicide. And a young boy of 21 years old. Discussing with my manager, just told me, you know what, if you need a week, if you need just a few days, just take those days, because we know that mentally you're not going to be there. And when I announced him the news, he just, he set up a call straight after, like, okay, I just want to hear from you. Let me know what I can do. But then the only thing I can tell you is just take the time you need to digest. And I think those are exactly what we expect from leaders, and really seeing that illustrated in the company from my manager, for me, it was a high sign. And I'm going to stop there. And of course, we can, I just really wanted to share those small examples, because I can talk about the policy, I can talk about having a psychologist in the company, what we have, I can talk about the many other initiatives we that has been implemented. But I think it's really those small things that are happening in teams, from your direct managers and from your colleagues, that are really making a difference when we talk about mental health. Maria also talked about this active listening, and I will even say this extreme listening piece. For me, it's also critical, is we never know what people are going through. They might even not tell us. Yeah, even sometimes be, quiet. It's really learning about being extreme listener and really see and hear what is not said or what is not vocal. So that's what I'm going to say and stop there for now.
Thank you so much, Alvin. And whenever you talk about practical, small tips, these are the ones who make a difference in our everyday lives. And of course, these are also useful, based on my experience, to change the habits. So there isn't a small example. These are absolutely critical. And thanks a lot for sharing your experience from global perspective. And if I can go back to Shunta, from OECD experience, I believe the audience of today would be very happy to hear from you. What are the key principles, in your view, that the EU should and could consider to achieve an adequate response to the tsunami of mental health issues in post-pandemic?
So I think one running theme that that's been coming up throughout is the need for integrated action, including in workplaces, and this is really probably one of the key principles. And as Alvin and Laura have already spoken to, it's important that line managers, for example, at work are trained and understand mental health issues. And this really applies across all areas of society. And Simon talked about schools, but it's everywhere. So GPs, teachers, line managers, caseworkers in employment offices. It's really important that we train all these frontline actors across society in mental health issues. And not just about the subject of mental health and not just about awareness, but making sure that they have an understanding of what steps they can then take to support someone who might be experiencing symptoms of mental health issues. And it's really great to hear from Laura and Alvin that a lot is being done in their workplaces to promote mental health and ensure line managers are trained. But one challenge, I think, for policymakers and something to consider is how can we ensure SMEs also have the capacity to train line managers in mental health issues. And maybe there might be scope for consideration for financial incentives for employers. And that way, that can both raise awareness and actually get the training going. And another interlinked area, which I think has existed from before the crisis, but is really important now, is how do we support employees experiencing mental health issues on sick leave? I know we haven't discussed this yet, but it's really, really important because a lot of people who are on absence from work are on absence because of mental health issues, sometimes said, sometimes not said. And actually what we find is this was an area that was really weak before the crisis. And it's really important to address this because in most cases, like with the adequate support, these employees can actually be supported back into work. And one recently implemented policy, for example, and actually there's not many, but in Sweden, employers are now required to draft return to work plans for employees within a month of sickness absence when they think employees are unlikely to return within 2 months. And when we're thinking about how many people have been outside of work for a long time, whether that be because they've been on job retention schemes or because they've not been in the office for a year even, it's really important that we think, how do we make that transition back to in-person work smooth, and how can we support the mental health of employees throughout that process? And maybe just one last thing I can mention here is that we are really increasingly shifting to this new world of work, as Maria mentioned in some aspects, and telework is becoming increasingly prevalent. And across the EU in spring 2021, around 24% were exclusively working from home. And so but with this comes new risks, right? Teleworking poses risks such as burnout, which I think Simon might touch upon, irregular and longer working hours, difficulty managing work-life balance, and all these things could contribute to poor mental health. And I'm actually really glad to hear that Maria mentioned, the right to disconnect law, because that's something that we've been following with a lot of interest. But it's really important that when we think about, mental health and work, if work is changing, policies also need to change. And I don't, have the solutions here for you now, because we're still seeing what kind of work we're going to see after the pandemic. But it's really important that we adapt the policies in place now. And maybe just last thing, because Susan asked this, I think, in a question to Maria too. So what can policymakers actually do in terms of integrated action? And I already mentioned job retention schemes, but also thinking about like how we make budgets, for example. And it's really one really interesting policy we've seen in New Zealand, for example, is something called the well-being budget, which was first established in 2019, in which where money is spent by governments was decided based on priority areas to promote well-being. And based on that, a large amount of money was dedicated to mental health, because if you actually look at what are the priority areas in terms of well-being, mental health comes up higher than maybe it does if you look at things from other perspectives.
Thank you so much, Shunta, for your input. And before I move on to Simon, because indeed, as the workforce is changing, policies need to change, and we need to find not only short-term but also sustainable long-term solution. And just to go back to one of your points about people returning after sick leave to work. I did quite a lot of research because I was personally interested, and I found a very interesting model, recovery pool, which in fact the first company I found that was an SME. That employed this recovery pool and helped colleagues after their sick leave. And of course, it wasn't related to mental health. It was after physical injury. But now there are quite a lot to learn from those good practices as well, and how to use with regard to mental health issues. And in that recovery pool, not only that people could gradually get back, but whenever their evaluation was in place, they weren't compared fully with the 100% or their full employees. And that's what I also felt after I returned to work, that not only that you are supported to get back to work, but there is an evaluation system. And of course, you don't want to miss out important evaluation in your career. And that's where corporates can also pay attention about how to support in terms of future career, because it's not only about the present and the past, but also to build a sustainable future career plan. That's what I always find interesting. And Simon, I have already asked the question to you. If you want, I can repeat. But that was basically on a changing workforce, changing policies, how to find long-term sustainable solution based on your experience.
Yeah, it's sustainability is really the question mark at the moment. We've all been coping, but not in a sustainable way. And Shunta mentioned burnout, and we're seeing large numbers of anxiety in the workplace, which leaves the workforce highly susceptible to burnout, and this is unsustainable. But maybe just to come back a step, the crisis distributed the workforce, and it really placed the responsibility of adaptability at the individual level. So individuals had to operate in their unique context, but not everybody's context is equal, as we've been discussing. Some people have small apartments with children and they have to work. Some people have larger places, no children, it was easier for them. But a distributed workforce, as we're saying, it's going to form part of the workplace moving forward. Work has changed. And as Shunta said, there's still always people working full-time in a distributed way. But that's not sustainable either. It's too much at one extreme. And this, the good thing actually about this is that what we're seeing in the research is replicating studies on distributed work that occurred before the pandemic. And that is, people tend to prefer around 3 days working from home, 2 days in the office. Around that, it changes on an individual level, of course. But the point for sustainability is that it has to be like a good balance. Work-life balance, basically, is what we're talking about. And organizations and policy needs to support their staff and their employees at the individual level, though. It can't be just blanket, you're working 3 days from home, 2 days in the office. Well, okay, that might not work for everybody. So there has to be a lot of flexibility into work going forward. But also organizations have to be forward thinking and realize that they can't go back to work as business as usual, where everybody's going back to working 5 days in the office. They're going to lose their talent, they're going to risk being competitive, and they're also going to go back to the old norms of their employees' health and well-being. So forward-looking and sustainable work has to be flexible and balanced between technology that supports a distributed workforce, as well as having the workforce meet still and having the benefits of their social interactions, which I think we're all poignantly feeling the lack of at the moment.
Thank you so much, Simon. And indeed, flexibility is important. In terms of finding a good flexible solution, we need to create an environment where we are indeed listening to our colleagues and taking their needs into consideration. And I think this is a very important point for talent, HR, diversity professionals to consider. And before I move to the next question to Laura, I just would like to encourage everyone, if you have any questions, because this is indeed a very thought-provoking discussion, please ask your questions in the chat box. At the end of the panel debate, you can also ask questions to the speakers of today. That being said, just to save time, if you would like to already think about your questions that you would find important and useful to ask. And Laura, if I can turn to you, you mentioned lots of indeed good MSD practices. I believe that even if there are good practices, not all of them are equally impactful. Of course, besides not all of them are impactful, we also need to think about what else we can do. Can you share some thoughts with us about what are the most impactful practices, and also what else you think we need to consider in the future? What else needs to be done?
Thank you, Elizabeth, for this additional question. The most impactful practice is empowerment, so that every person, right? Of course, we need to start with the leadership. Both myself and Alvin, we have talked about that, how important are the leaders, right? Just to set the tone. But then this needs to be cascaded down, and every member, every employee needs to feel empowered to take care of the colleagues, to take care of themselves, first of all, to ask, are you okay? To answer, no, I'm not okay. To integrate the fact that it's not only okay to take vacations, it's an obligation to take vacations. And it's not okay to answer your emails during your vacation. So you need to take your vacations and have a delegate that will look after things, because we need to recognize that, yes, we are important, but there are other people that can move things on. This is why we are in a big corporation. So I believe a lot on empowerment, so that every person, every employee will be able, to keep building this environment that we want to see. It's not an email. I mean, the leadership is very important, but I tell my teams every day is you are not going to get an email from the CEO telling you need to take your vacation. You need to organize your vacation. You need to take responsibility for taking care of yourself. This is my main duty as a leader. I am a leader of a big organization, more than 2,000 people in 35 countries. So my main responsibility is to ensure that people feel empowered, right, to do what they need to do to deliver on the results. And being okay is the first step, right? I need to be okay. I need to take care of myself so that I feel strong and I can move on. And if I'm not feeling strong today, I can also ask for help. So it's really empowerment about taking care of myself first so that I can take care of my duties, and also admitting that sometimes I need some help.
Thank you so much, Laura. And indeed, these are really important aspects. And whenever we talk about empowerment, I also see, I myself am from Central and Eastern Europe. So if you ask the question, how are you? We respond in a different way than probably Susan or someone from coming from the UK, and that can be sometimes a misunderstanding. But it's not only the misunderstanding, but diverse leaders also need to be very careful about the diverse responses, and not just to be satisfied if someone say yes, I'm fine, or someone is sharing in more detail. For example, my colleagues back in Hungary, I'm Hungarian. By the way, they spent about 5 minutes explaining all the challenges, and that was 20 years ago. So these are really important aspects. And Alvin, if I can turn to you again. You, in your various roles, and apologies that I said leader, but now I understand that you are leading on this this important topic. I believe you are involved in working out strategies
Yes.
within the firm.
Yes.
And in terms of working on the strategies, in your view, which strategies can help corporates to support employee mental health, and also starting from the interpersonal side of things?
Well, I'm going back to being a business conversation, because I am in the pharma industry. If we take care of our talents, then they are taking care of our patients. So it's really critical to really make sure that in the strategies, it is part of our DNA. It is really embedded. And I like what Laura said about the empowerment. So now in terms of strategy, because the strategy is really holistic, it's really a vision, is really where we want to go, and globally. And the strategy can be, as you say, but for me, it's not about the strategy. I'm getting back to the culture piece. For me, maybe probably you know that, culture eats strategy at breakfast. You know that maybe. So for me, it's really all about the culture. And of course, and then when you're building your strategy, first of all, you need to have the organization. And for me, when we talk about the strategy, the middle management piece is critical, because they are really the change agents when you're working on your strategy. For me, the middle management is the one who is really going to make the whole thing, the whole machine, and that middle management, as someone said, needs to be trained. I don't know if I can talk about training, but it's really about educated. And we currently have, if I take the example of Europe, we have a program called Inclusive Culture, where we really had sessions across Europe and about equipping our managers on what it means to be inclusive. What are the talking, of course, about bias, and when we talk about mental health, as I said earlier, you can have someone in front of you, maybe late in delivering a project. Why? And instead of going straight to the judgment, like, okay, that person is lazy, that person doesn't want to work. How do you really pause and stop and really make sure that you're fully understanding what's behind someone not delivering on time? So when I talk about strategy, when related to your question, for me, the middle management is critical, and that middle management needs to be equipped and educated. And when we talk about inclusion and inclusive leadership, it's about constant learning, constant exercising, being inclusive as a manager and as a leader. It does not happen overnight. And I'm going back to the culture, and the more you see your manager behaving a certain ways, the more it's also having a positive effect on yourself. Clearly, going back to what Laura said about empowerment, because I see my leaders behaving a certain way, because I see my direct manager behaving a certain way, I feel so okay to say, well, today I do not. Today I don't feel okay, and so I will even send an email like, "Do not send me an email today because I'm not okay today." It's okay to say that. It's okay to send an email such anyway. So when I talk about the strategy, for me, it's really about that middle management piece and the psychological safety. How safe are talents, colleagues, enough? Are they safe enough to say, it's not okay? Because that the culture should enables that safety, that psychological safety first. So I can talk about many things when you talk about, of course, about strategy, but for me, it's really about that middle management. Of course, at the end of the day, it's for the benefits of the patients we all serve at Pfizer.
Thank you so much, Evin, and I fully agree with every word you just said. I myself, when I learned CBT techniques, that was even besides the cultural aspect, that was one of the most useful exercises to avoid jumping conclusion whenever it biases or whatever. My therapist always advised me to bring up 3 answers, not jumping to one conclusion, and it really helps your mind to think in a completely different way. And indeed, whenever it comes to culture or any aspects, that's really important that we stop and think a little bit before jumping to conclusion. And change agents, indeed, they are extremely powerful because they can make significant changes. And today's discussion, of course, involves lots of discussions on policies. And Shunta, if I can turn to you and I can ask my next question to you. What are the most important questions policymakers should ask and also answer to make sure that their solution take into account mental health consequences?
So I think whenever policymakers implement policies, even if it might not feel like it has a direct impact on mental health, it's really important they think, okay, what is the impact of this on mental health? When we talk about policies, we often talk about how gender blind is not gender neutral, but in the same way, like if you just implement policies without thinking what might be the possible mental health consequences, you can create adverse consequences. And sometimes in a way, you can design policies in a way to help cushion the impacts on mental health. So one interesting example is if you think about lockdown measures and constraints put on people's movement, in some countries, support bubbles were put into place so that people who are living alone would be able to actually see people, and that way they'll be able to maintain social contact, and that would reduce risk of loneliness, which is a key risk factor for mental health. So this really also, I think, applies to all areas of policy. So again, I mentioned job retention schemes just now, but also thinking about things like public employment services, right? When we're thinking about how are these designed, what are the mental health implications? These are the questions you need to keep asking, the how and what are the consequences for people's mental health. And then the other thing I would say, and again, this is probably a bit of a running theme, is we need to ask whose mental health is being affected the most, and we need to make sure policies target these groups. And we know, for example, like individuals with low incomes and from more disadvantaged backgrounds are more likely to have poorer mental health. And on top of that, in most cases, are experiencing a greater deterioration in their mental health during the COVID-19 crisis. So it's really important that we close inequalities, both in terms of actual access, for example, to mental health services, but also these socioeconomic inequalities, because they bleed and they are the consequences that then drive the mental health inequalities that we see, as I think Maria mentioned.
Thank you so much. And so many of the panelists are referring back to you, Maria. And as we have the opportunity that you stay with us, and thank you so much for not leaving right after your speech. We really appreciate you staying with us. Can I also ask you the same question? What are the most important questions in your view and in your expertise that policymakers, the EU policymakers, should ask and answer to make sure that their solution take into account mental health consequences?
Yeah, thank you. No, and I made it a point to stay because I'm writing so many pages of nuggets of gold that is coming out, and my Twitter fingers can't keep up enough in terms of sharing information. So thank you all for gifting me such great info and learns. I can answer this question in a couple of different ways, but I'm going to answer it as authentically as I can. There is a huge disconnect with what goes on in the institutions, what goes on in the organizations that the panelists are working in and yourselves, and then what citizens are talking about. And the biggest disconnect in my eyes is what we do in the Parliament and the Council and the Commission, and then what our citizens are asking for. Two key things came up for me over my first campaign, which was in 2019 to run for the European elections. One was, what happens in the EU institutions, bar funding for roads and infrastructure and buildings and programs, and then what are you going to do for my mental health? They were the fundamental two questions that came forth. And I think when we talk about policy making, we have to figure out a way, and I'm a part of it, so I'm a culprit to it, figure out a way of making it less dense and political and really the policy language, or the Brussels bubble speak, as I like to say, and more about like asking the questions, exactly what we're asking businesses to do with their employees, like ask a question, wait for the answer, and then build policy around. Now, that's the really authentic way of leadership, I believe, but that's not how we can do it all the time. But one thing I'm doing in all the work I do, so I have a file right now on cyber violence, particularly on gender-based violence, which consumes, it takes into the mental health aspect. I'm looking at pay transparency and minimum wage, because for many, it predominantly affects the most vulnerable, and women are included in that. And as an LGBTQI woman and activist, then that's another angle to what I want to change and impact. We're doing, my team and I are doing these virtual roundtables of much like you guys are doing here, collecting as much info and having conversations, so that that's impacting the policy and legislation that I'm putting into my work in order to bring to the plenary floor and push forward. So it's a slow process, because unfortunately politics is not parallel to society. And society is moving a lot faster, technology is pushing us a lot faster, and the political realm is just trying to keep up. And that's one key fundamental issue I have with policy, is how do we just get a little bit ahead of the curve, so that citizens feel like they're moving with everything, versus consistently arguing or debating or protesting to say we need this and why isn't this happening. But fundamentally it comes down to the conversation, the openness, and making it more relatable and transparent. And what was just shared, the well-being budget, I think I have about 16 stars around it. Like, that is where policy changes things. A huge part of the European year for me and my colleagues, in the reason of creating it, absolutely, it's for the PR opportunity. It's to make sure mental health is at the forefront of everybody's mind consistently, and taking the year allows us to make a lot of things happen in the politic world. But how we're going to change policy and legislation is through the likes of wellbeing budgets, that every time a financial minister or a commissioner or MEP like myself decide to spend taxpayers' dollars, we are doing it with two things in mind: mental health and the impact on our climate, and both go interlinked. And I think when we have that, then we're really seeing change. And then we pave the way, and then we work with not just the European Union countries, but the identities right across the pond. That's. I hope I didn't talk around in loops, but that's where I feel like that.
Thank you so much, Marie. And indeed, the European Union, what we're also proud of, and that's an opportunity to have an impact on other countries. In our public policy work, we often measure the impact. That's the company I work for, and it's more significant than what we would believe in Brussels. So indeed, it's very important. And with this panel discussion, before we close, my last question, as we were planning and targeting to get some practical ideas, I would like to ask one final question before I move to the audience questions. From all of your perspectives, what are the available toolkits for business leaders? And I believe we can discuss it from OECD side, if Marie is here with us, from the EU side, practitioners and corporates. And if I can start with you, Shunta, please.
Yeah, great. So, what's really important about these toolkits and guidelines is that they call for a whole of workplace approach to promoting mental health of all workers at work, right? Not just people experiencing mental health issues. So In some countries, I have to say, there are policies that are put in place, which is really about identifying people experiencing mental health issues and then providing adequate services or support for them. And this really isn't enough, right? This doesn't get to the root of the issue. And it's not about, for example, like giving free membership to access online mental health services through apps, for example. That can be part of the solution, but that's only part of the solution. And to that end, like two kind of interesting guidelines we've seen is Canada's National Standard for Psychological Health and Safety in the Workplace, and the UK's Thriving at Work recommendations. And both of these do provide useful mental health guidelines for employers. It's been commissioned by governments and then working closely with stakeholders and non-governmental organizations. They've developed these guidelines. And just for example, Canada's national standard sets out 13 factors from promoting mental health. And it goes beyond just things like workload management and providing counseling, but also looks to organizational culture, which is exactly what Alvin has been talking throughout about. And this is really important. Providing opportunities for career growth and development, that also has implications for mental health. And creating that sense of connectedness and cohesiveness among employees in their day-to-day work. And so really, these kinds of guidelines can make a difference, I think. And a survey in 2019 actually found that employees in companies that implement the Canadian National Standard actually have employees are significantly less likely to say their workplace is psychologically unhealthy or unsafe. And really, this is giving some indications that, even if they're only voluntary standards, employers could benefit from actually adopting these practices.
Thank you so much. And indeed, guidelines are important because there isn't a one-fit-all solution. So a good guidance could be extremely helpful. Maria, have you got any suggestions or toolkit for business leaders that you find useful to share?
Hard to beat Shunta's points of view there, but engagement. If you have a business that, I think technology is a wonderful thing, and we're so interconnected. So if there's businesses in the likes of Canada or elsewhere that, or across the EU that you feel are within your realm and that you can match and learn and become an ally in terms of the mental health space, I think that would be quite a savvy thing. I think talk therapy, and if you have the resources to provide talk therapy supports like coaching in businesses, I mean, sky's the limit, because I think it was Simon who shared, like, people don't just work Monday to Friday and go home and live their lives. Like, their lives are a part of business. And in many ways, as businesses are growing and entrepreneurs are developing amazing kick-ass ideas coming out of COVID-19, I think the fact that we can interconnect both, because they do, and we have to acknowledge that. And I think talk therapies and coaching really guide someone for showing up to work, but equally going home with the best mental health and well-being that they can. I think as leaders, and I'd love to kick the question out if we have time, Elizabeth, like, what are the daily practices we're all doing? And as leaders, much, just to share and talk and be vulnerable in that space of, I'm going out for a walk. When I'm back in Brussels, one of my meetings every day has to be outside because I don't get away from the screens otherwise. So I do one-on-ones with my team outside, and we walk around. They're probably not that happy, but it allows us to engage and get away from the space, and like little isms like that really help. I think as leaders, and much to Alvina's point, I think it was around middle management, that is the amount of people I've worked for, and I used to work in the creative world in the States, where I've scratched my head going, why couldn't management just give them money and not people? Like, I don't understand how in this day and age we haven't figured out a way to upskill or blueprint that middle management role. And then ultimately, middle managers create bad middle managers, and it's not their fault. We just need to provide skill sets, and talking about it and being vulnerable to that conversation, I think, is incredibly important. Keep hounding your representatives, myself included. If you're not seeing something, you make it known and make it heard, and I could go on. And ultimately, much to everybody's points, if you're finding something that's working for you, stop containing it, share it. And I think that is where we end up with a lot better conversation that's really engaging versus surface level. And that's ultimately where great businesses and great communities from it. Thanks, Liz.
Thank you so much, Maria. And I'm really sorry to say that this is the end of our discussion because we need to keep the time. And I'm really grateful for all your inputs. There are 2 more questions in the chat box. We will get back to you. I promise. One of them is highlighting that with the work from home, reality is changing. Many employees' long-term plans in terms of housing, finances, growing their families. How can employers contribute to alleviating this stress, given that different employees will have different needs? And there are lots of questions, and probably if we have the support from Susan to continue one day this discussion from an even more practical perspective, that would be extremely helpful. Once again, thank you so much for your thought-provoking points and the discussion. And Susan, I would like to give the floor and the screen back to you.
Thank you. I mean, what can I say? Thank you so much, Elizabeth. It was fantastic moderation and getting in so many questions, but really it was an amazing panel. I hope that everyone on the line has not just enjoyed it, but been inspired and I think learned something. I was scribbling away madly. I think it's the most notes I've taken from any meeting for a while. And I genuinely mean that from my heart here. I'm trying to think what to sum up. I think the word that came out very strongly from everybody was culture. So I did myself a little mind map on a piece of paper here, and the culture word is in the middle, Alvine, and a few things that spread out from that. So that's one thing we take away would be the culture. Okay, let's start with leaders. That was mentioned. It comes from the top. I hope many people here have listened, but also if you take that leader bit, then this middle management and the training and the coaching. So we all play a role. So that's the one thing from there. Another part from the culture, active listening. We've got to be aware, how are you? And Elizabeth, as you said, in every country, it's a different answer. We've got to be aware of what that means, but we do have to be actively listening. The other one that comes out from the culture, empowerment. Yes, empowering. We all need to look after ourselves as well. Look after the most vulnerable. I think everybody probably in this line, we're all suffering from this. Everyone needs to look after themselves. Flexibility came up. I think that's connected to culture. Let's disconnect more. Absolutely. Let's do some shorter meetings. Let's go for the walks. It's a culture at the moment of non-stop. This is just not healthy. Talking, don't bottle it up. Talk therapy, really like the idea about that. We need some training on this. And my last bit was a dotted line out of culture, but I just wanted to mention SMEs. I think it's great to hear from the big companies. We represent big companies, but we ourselves are a small company here. AmCham's small. We've got 27 people. How do all these companies cope? You don't have the resources for all the training and everything that's required. I think we really need to think about SMEs and the other socio-economic groups, perhaps those who are not on this call today. Who is not on this call today and who do we need to help? So with that, I just wanted to mention one other fact. Actually, it was in the 2008 economic downturn. The impact of that downturn was only on mental health was 4 years later when it really started to hit. I mean, the statistics that some of you have thrown out, we're already seeing it. So I'm frightened to think what might happen in 4 years from now. We probably haven't seen the full impact of this particular economic downturn. So I think we need to be careful. I really like the point of who is it we need to target? I think that was Shunta. Who is it? Let's really define who is it. I mean, as the mother of 3 kids, I'm not saying, I have a problem, but I've got girls, young girls. I can see the friends. I absolutely agree. It's a big problem for the youth. It's really, I've heard many stories about this being a big problem. So to close, Elizabeth, maybe I would say, let's break the taboo. I think we've started today. Let's stop this stigma of talking about it, people being frightened. I certainly stand ready to do my part. Mental health is health. It is health. It's mental and physical. Mental health is health. That struck me very strongly today. And also, yeah, it has to be sustainable, not just something we talk about. I think Simon mentioned that it has to be fully sustainable. So with that, I really hope optimistic. I'm going to finish on a really optimistic note because it's so inspiring to have people like you all on the panel, like Elizabeth leading, like Maria leading in the institutions. So Alvin, Laura, Shunta, Simon, Maria, Elizabeth, thank you all so much. I wish everyone the very best health in all ways. And let's continue, excuse me, and let's continue this conversation. It's really a very important one. Thanks to everybody for today. Thank you very much.
Thanks, Susan.
Thanks to all of you.
Thank you very much for everyone.
Oh yes, and I should have said, this is a very practical slide, in fact, to, you'll see some practical information there. If you or any of your friends or family or colleagues is seeking help, there's some very practical numbers that you can use. Excuse me, my throat's closing up now. Actually also, I almost forgot, there is now a networking session. So if any of you wish to stay on for 15 minutes, please do. We can put those numbers up, I'm sure, in the chat as well. So please do stay on for that networking. If you don't wish to, there's absolutely no obligation. And I wish you a wonderful rest of day and a wonderful week. So see some of you soon. Thank you all.